This is the case of a patient with ischemic cardiomyopathy implanted with a dual lead ICD. This episode is a fast VT episode, so initially there is a conducted atrial fibrillation, then an acceleration of the ventricular rhythm and a stabilization. This is now a VT, so there is a dual tachycardia. The initial detection is in the fast VT zone. The first therapy for this zone is a burst. It is non-efficient. The second therapy is also a burst, non-efficient. The third therapy is a burst. So again, redetection in the fast VT zone. The next therapy is the delivery of an electric shock with reduction of ventricular tachycardia. In this patient, the fast VT zone has been programmed via VF. It means that both in the fast VT and the VF zone, the probabilistic VF counter will be used. For tachycardia faster than 200 beats per minute, there is a risk of undersensing, so the VF counter is probably more appropriate than the VT counters that requires consecutive cycles. So, what are the reasons for programming a third detection zone, the fast VT zone? It is not a question of counting, since we have explained that both in the fast VT zone and in the VF zone, you will use the same probabilistic VF counter if the fast VT zone has been programmed via VF. It is not a question of discrimination. This is a specificity of the Medtronic devices, but you can discriminate the origin of the arrhythmia in the fast VT zone, but also in the VF zone. You will program a limit for discrimination, which is independent of the programming of the zone. This is really specific to Medtronic devices, and it is not possible to discriminate the origin of the arrhythmia in the VF zone for the devices of the other company. The main interest of programming this third zone, so the fast VT, is the possibility to program more sequences of anti-tachycardia pacing. So this episode has been classified in the fast VT zone, so 3 sequences of anti-tachycardia pacing could be delivered, what would not have been possible if this episode had been classified in the VF zone.